Welcome to video series on acid-base balance. This video is on respiratory acidosis. Let us understand the biochemical changes taking place in respiratory acidosis. Now there occurs accumulation of acids resulting in increased concentration of hydrogen ions, as a result of which pH drops and acidosis sets in. Now, respiratory acidosis is a condition characterized by accumulation of carbon dioxide in the form of carbonic acid in the lungs. Now, let's consider the ABG analysis. Let's consider only the three components: pH, bicarbonate, and partial pressure of carbon dioxide. What happens to pH in respiratory acidosis? It is decreased, bicarbonate is normal, and partial pressure of carbon dioxide is increased. Now, this is the respiratory regulation of pH by the lungs. As we all know, the inspired air contains oxygen, and this oxygen is taken up by hemoglobin, which becomes oxyhemoglobin. This is carried to the peripheral tissues by the capillaries, and here unloading of the oxygen occurs and hemoglobin is now free. Now the metabolism of the peripheral tissue generates carbon dioxide, and this carbon dioxide condenses water to form carbonic acid, which dissociates to form hydrogen ion and bicarbonate ion. Now these H plus ions are buffered by hemoglobin, which becomes now deoxyhemoglobin. Now this bicarbonate moves into plasma in exchange for chloride, which is known as chloride shift. At the level of lung, what happens inside the capillaries is that there occurs reversal of the chloride shift. Chloride ion moves into the plasma and bicarbonate moves inside the capillaries. Now, the deoxyhemoglobin releases the hydrogen ion, and hydrogen ion combines with the bicarbonate ion to form carbonic acid, and this hemoglobin is free for uptake of subsequent molecules of oxygen. What happens here in respiratory acidosis? There occurs accumulation of carbonic acid or carbon dioxide. What are the causes for respiratory acidosis? The first cause is pneumonia. Pneumonia can be bacterial pneumonia, viral pneumonia, or protozoal pneumonia. In any type of pneumonia, there is alveolar inflammation resulting in production of exudates. Now this will impair the exchange of gases, resulting in hypoventilation followed by carbon dioxide accumulation and respiratory acidosis. The next cause is bronchial asthma. Bronchial asthma is a chronic inflammatory condition by airway obstruction. Now, because of airway obstruction, what happens? Exchange of oxygen and carbon dioxide is impaired, resulting in hypoventilation followed by carbon dioxide accumulation and respiratory acidosis. Next is bronchitis, which can either be due to infection or can be triggered by an allergic response. So this results in the production of thick mucus, again which will impair the exchange of gases, resulting in hypoventilation, carbon dioxide accumulation, contributing to the development of respiratory acidosis. Next cause is obstructive sleep apnea syndrome, characterized by collapse of the pharyngeal airway. So this will result in decreased airflow in spite of good respiratory effort by the patient or the individual. So resulting in hypoventilation, carbon dioxide accumulation, and respiratory acidosis. Last one is respiratory center depression, either by head injury or by drugs like opioids, which includes morphine, general anesthetics. So all these agents will cause which will decrease the respiratory rate, resulting in hypoventilation followed by carbon dioxide accumulation, respiratory acidosis. Now, what happens to this ABG analysis? pH is decreased, bicarbonate is normal, and partial carbon dioxide is increased. This is the basic ABG finding in respiratory acidosis. Now, let's understand how this respiratory acidosis is compensated. Compensation rules include: compensation always involves a counter variable, but in the same direction as that of the primary variable. Consider this Henderson-Hasselbalch equation, which states that pH is equal to pK plus log of bicarbonate to carbonic acid concentration. So in respiratory acidosis, the pH is decreased, whereas bicarbonate is normal, and there is increased carbonic acid. So the compensation involves the counter variable. Counter variable here it is bicarbonate, and involves in the direction of the primary variable. Primary variable is increased here, so the compensation also involves by increasing bicarbonate. So all the three different regulatory mechanisms come into picture. Here the buffers will come into picture, but they will not go for completion. So lungs will not be in the picture because lungs they themselves are involved. So the main regulation of pH here is done by the renal system, where the bicarbonate is absorbed to increase the bicarbonate level, whereas there occurs excretion of H plus ion titratable acid and excretion of ammonium ion. So this compensation will come into picture only when the patient is having normal kidney functioning. If kidneys are damaged, again this is compromised. So this was all about respiratory acidosis. Next video will be on respiratory alkalosis. Please do like, subscribe and share this video to all your friends. Thank you.